In this segment, we are going to talk about the do's and don'ts of pregnancy. Be aware that pregnant women may not take your advice seriously because of how young you are. However, young girls will likely take your advice more seriously, and if they do become pregnant, they will have a baseline knowledge about maintaining a healthy baby. A big point that is important to communicate is that all decisions during pregnancy affect both the mother and the child. Though this may be obvious, certain actions that mothers take are different based on cultures.
On the physical health side, making sure that women have the right nutrition to make sure their bodies are ready for pregnancy, and during pregnancy to have the right nutrients, and to not have to also go out in the field and do really heavy manual labor.
During pregnancy, mothers should avoid drug use, alcohol use, and taxing physical activities. Pregnant women should eat enough to sustain both themselves and their child. Diet is extremely important for maintaining a mother's health and facilitating the child's development. Expecting mothers should take prenatal vitamins or eat extra fruits, vegetables, and grains if possible. Make sure you are culturally aware of what sources will be accessible to the community.
Oftentimes women may not know if what they're experiencing or what their baby is going through is really worthy of a trip to the clinic that might be several kilometers away, without transport in the rainy season, with the bad roads, and they don't know if the clinic is open. So you might have a symptom or a condition and you're not sure, is this something that I need to seek help for?
If the woman is experiencing bleeding, severe cramping, swelling of the feet, hands, and face, headache, dizziness, blurry vision, or severe anemia, she should see a doctor immediately. While many deliveries take place in hospitals, some areas either do not have access to nearby hospitals or have a midwife in the area who aids with deliveries. Make sure that you are aware of this possibility when you go into a community. If a home birth is necessary, a midwife or other trained professional should be present to ensure the safety of both the mother and the child. If the mother experiences hemorrhaging or infection, immediate emergency care is required.
Birth is a really normal process. Nothing would happen. But if you were one of the cases where something did go wrong, you want to be sure that you had a good emergency referral network in place. But the fact is that most places where we're concerned about home births don't have this referral system in place. So if a woman has a problem at 3 a.m., she's unlikely to be able to find transport to be able to take her to the nearest clinic. Even if she got there, they may not be open, they may not have the supplies, they might want her to go out and buy gloves and buy the supplies, and the nearest facility that's really capable of something more advanced might be just too far to make it in time. So, again, really nothing wrong with home delivery because birth is natural. It's just the context around you because of these really hard to anticipate emergencies. The last time I was at a clinic and I had an extra soda, and the nurse asked if the woman could have the soda because she just delivered a baby and had no food. But that's one reason why women choose to deliver at home, because they have sort of the comforts of their own home.
Common forms of birth control that you may be familiar with are the male condom, female patches, and female pills. However, there are many other forms that are common in other cultures. When you are teaching about the subject, focus on birth control as an option to avoid pregnancy, rather than focusing on specific birth control methods. However, if you are able to determine what methods of birth control are most accessible in areas, it is certainly useful to teach about those. Accessibility to birth control varies among countries due to laws, costs, and cultural views. Do not assume that people you are working with have access to the forms of birth control with which you are familiar.
So in general, there's pretty good family planning programs in developing countries, if we're talking broad brushstrokes here, for families, for how to do birth spacing. There's a huge amount of international money going into birth spacing and limiting the number of babies a woman has so she doesn't get worn out with 8, 10, 15 babies. But there has not been a lot of money or attention, probably for differing political and moral reasons, for educating adolescents about access to birth control.
So some of the barriers to meeting this need for contraception can be cost, that the methods themselves are expensive. Women might want longer acting methods that they'd have to pay for and can't afford. There could be sort of a knowledge gap, that women or men don't know what their options are. So a lot of work is to educate people about the methods, different methods of family planning, because there are many methods, and what the sort of risks and benefits are of each one.
It can be challenging for women and men to get birth control if it's highly stigmatized, if it's assumed that you're doing something bad or inappropriate. That's particularly true for women. I mean, it's perhaps only recently that women felt comfortable buying condoms or recommending a condom in the United States. So I don't see this as a us-them. I see it as a continuum of how we think about empowering people to make appropriate health choices.
After delivery, it is common for women to breastfeed. However, in some cultures, this practice may be stigmatized. Be aware if this stigma exists in the community. Breast milk is the best source of nutrients for the newborn, as it provides immunity from the mother. Breastfeeding also hormonally promotes the mother's recovery from pregnancy. While being respectful of the culture around you, try to communicate the benefits of breastfeeding.
So the recommendation is to exclusively breastfeed kids through the first 6 months, and ideally breastfeed through the first 2 years. Stigma could partially play in it. She did talk about some cultural factors, but a lot of it was more socio-cultural, that it's really hard if you don't have refrigeration. It's not like here where a woman could pump milk and store it in the refrigerator, let's say, and use it 8 or 12 hours later. If you're working in a place where you don't have electricity, where you don't have refrigerated storage, you're less likely to be able to breastfeed, because you also have to go out and work. It's not that women wouldn't recognize the value of exclusive breastfeeding, or they couldn't understand that. It just logistically be real tough for all women to be able to make that happen, given the realities of sort of our economic situations.